assistant would be putting it on the trolley. And this is sterile instrument, so he doesn't have to touch. You have to touch it by yourself. वो कुछ नहीं, वो पैकिंग है, तो लॉक किया गया। Distilled water. We will use normal saline for irrigation. So there are different kind of button. This is one white and grey button. First you have to press white, so then the water will start flowing from there. When you press it completely, then needle will be coming out. Right now this is not in active mode. You will see, and this is the button to release the needle, and this one is for making the vapor. So there are 4 tubes attached here. One is for power cable. This is for outlet. This is for normal saline irrigation. Normally we take 3 liter saline bottle, and this one we for the making the vapor. So we use water for making the vapor, but we use irrigant fluid as normal saline 3 liter. And this is the plunger. So you can see this is unscrewing motion. So you can fix it here and just lock it. Now this is locked. You have to remove this and now you will connect it. There is a needle here to take the take a spirit saline. Give me some sanitizer or a spirit of the distilled water bottle to make it sterile. Make it up. Distilled water which we are filling in the syringe, and this will be used to make vapor for reflection. So there is a mark given here. We take it till this mark. Right? There should not be any air bubble left in the syringe. We will make sure that all the air are expelled from the syringe. Now this syringe is ready here. To remove the plunger by unscrewing motion, so anti-clockwise movement, and this will come out. So now this syringe goes and fits into the machine like this. So this has to be connected with the handheld device. So first there is power cable. Well, also you have to see there is a white button, white dot. This white dot has to be matched with the pink dot, and then it goes easily. You can see this is green, means it's properly placed. The next thing would be to place the irrigant channel. 3 liter saline यहाँ लटकाओ, इस तरफ लटकाओ. You can see there is a stop button. So this is for outlet. When you see some blood or something, you want to drain it, then you have to open it. And there are 2 more things, 2 more tubes you can see. Irrigation of normal saline, which usually we are taking 3 liter bottle. So this will be connected to 3 liter saline. And this will be fitting into this syringe. Just remove this stopper and gradually lock it. This will get locked. Make sure that there is no leak here, otherwise vapor will leak. So this is green button showing that this is properly connected. Now this tube, this one. So see, there are 2 different color coding given here. One is purple, other is green. So purple has to be matched with the purple and green to be matched with the green. Like this. Correct? And then this goes and now you can see this is the green tick. It means that it's properly connected. Please ensure that the syringe water is connected. So already we have connected. So I think our initial setup is complete. So see, what we have to do first, this is the white button and this one is the grey. So first, just press the white button, you will see that fluid will start coming. So first the tubing will be filled up and then it will come there. And then clear fluid is coming. So now you have to press the both button. Both means you have to press the grey button as well. Once you place the grey button, you can see the needle has come out. Right? So needle is deployed. Then you see here the priming is ready for priming. So means now we can press the blue button. So that will make the vapor. So I have pressed the blue button and priming has started. See there. It will take around 30 seconds for priming. Priming means the water is getting ready to make vapor. You have to wait till the priming is complete. Priming is complete. Okay. So now we have to put the needle back by pressing this button. So now needle has gone in. So now our device is ready to start working. One more time I have to do the same procedure. Press the white button and the grey button at the same go. So now you see the needle has come out. And then press the blue button for 9 seconds. See there. So this is performing a pre-treatment vapor cycle. Now you see here, the vapor will start coming. Zoom it out. Shake. Now we retract the needle. That is 30 degree 4 mm that we are using. There is a groove here which easily admits the cystoscope lens is going inside the handheld device and this gets locked with a click. So our device is ready now. Camera is connected. So when you are going inside, you have to press just white button so that you get some fluid, and irrigant fluid will make the vision better. So I have not deployed the needle. This is only fluid that is coming. You can see the urethra. Recording on it? Yes, sir. So you can see the urethra here. Make sure that the needle has not come out, otherwise it will traumatize. Always keep the vision in the center so that urethra is visible. So there is little resistance here. This is the verumontanum we see. This is both right and left lobe enlarged. Median lobe is not significantly enlarged, but there is little bit of high bladder. Now we are entering into the urethra, and make sure that only the white button is pressed so that there is some irrigant fluid which is coming and making the vision clear. Needle should not be deployed, that will cause injury. So needle will be deployed once we have found the correct point of entry into the prostate. So first we are seeing the bladder neck, and this instrument length is around 0.5 centimeter. So by just moving it twice, we make the point which is 1 centimeter away from the bladder neck. First we are going on the 9 o'clock position, that is in the left lobe. Needle is deployed here, and we are waiting for 8 seconds so that the vapor is going inside. We can see the bulge in the prostatic mucosa, and we have to keep it there till our vapor has gone. Now the needle is out, and we have to go on the opposite side at 3 o'clock. In this case, prostate is not that big, so 2 or 3 puncture and injection is quite enough. In bigger prostate, similarly we can go on both sides twice, so that even 4 puncture can be done. So we have to make sure that we don't come below the verumontanum, so that there is no incontinence and we do not go into the sphincter. So the point of entry has to be proximal to the verumontanum, and we should not be injecting the needle at 6 o'clock, because here the needle has a chance of going into the rectum. So it should be only 3 and 9 o'clock. Sometimes if the median lobe is there, we can go there also.
Thank you for watching this whole video.